Back to Chartbusters here on CNBC-TV18. Well, we just had one company that debuted today and listed with good gains, but the real standout performer has been Global Health. Those stock, in fact, have seen a big rally. It's locked in upper circuit up close to around 20%. The chairman and managing director, Mr. Naresh Trehan, as well as the group CEO, Mr. Pankaj Sahni, they join us on the show. Hi, Mr. Trehan, as well as Mr. Sahni. Thanks so much for joining in. And congratulations on a solid listing. You know, a lot of those IPO applicants, they'll be very happy today to see the kind of listing. But that's putting even more emphasis now on the numbers that you all will deliver. The expectations will skyrocket in line with what the share price has done. Give us a couple of details. The occupancies, well, they were hovering around 60% odd. If you could tell us, what's the number that we should be working with for the second half of this year? And your average revenue per occupied bed, that was around that 59,000-60,000 odd. Where is that number headed?
So when you look at our occupancy figures, it's important to understand that we're currently having 5 hospitals which are operational and the 6th one in Noida under construction. Our hospitals in Lucknow, which is approximately going to be 1,000 beds by the time it's done, and our hospital in Patna, which is about 650 beds by the time it's done. Both of these hospitals are only about 50% in terms of their built-out capacity today. So we continue to add in beds over the course of the next couple of months. That will continue on into the next financial year as well. And we've been very confident about the performance in our existing mature facilities as well as our facilities in Lucknow and Patna. Both of these facilities have seen very strong growth. Lucknow performing exceptionally well in its first year itself, growing occupancies upwards of 60% as we move forward. So as we keep adding beds, we will keep filling in the capacities across the hospitals. Our mature hospitals are about 65% occupancy levels. So we feel fairly confident about the growth that we see coming in, not only in the short term, but as we look into these capacity expansions in the medium term as well, you'll see this growth continuing as we move forward.
Right.
In terms of our average revenue per occupied bed, you're right, we're at about 60,000 when you look at it at a consolidated level. But once again, we continue to see growth coming into the newer assets. We continue to see teams getting added, new doctors coming in, new services, new specialties getting added. So all of this will continue to drive us as we move forward into the subsequent quarters of this financial year, and as we look forward to getting ready for financial year 23 as well.
So you must note here the fact that this is all driven over the back of the finest quality of healthcare that can be delivered. So our patients have actually contributed to our success because of the fact that we do have that model where all the super specialists are working on the same platform and are able to give their best to any and every patient that comes into the Medanta system. So this has rewarded us handsomely, and we will continue to stick to our core of the highest quality at the best affordable price that we can give. So that's the story which is unfolding, and it has over the last 10, 11 years, and it will continue to roll out as we build and into different areas.
That is the crux, Dr. Trehan, that, you know, high quality healthcare at affordable prices is what makes you successful. And at the same time, while you credit your patients to your success, I would say we should also credit you to your patients' successful treatments, etc. But as far as the markets are concerned, we're looking at the way your business grows from here, given the fact that you're doing extremely well right now, and that is obviously a given. Pankaj, just a word on the number of beds that you have right now. By the end of this year, what would that number totally be at? And what is the road to 3,500 to say 4,000 beds? Just wanted to understand, because you said currently 65% of your revenue is coming from mature beds, mature hotels, hospitals rather, and the remainder will obviously start improving, right?
Correct. So we are currently at approximately 2,500 beds across the network, across the 5 hospitals that I mentioned. That's in Gurgaon, in Lucknow, in Patna, Ranchi, and Indore. And these beds will scale up to about 3,500 by financial year 25. The bulk of that incremental capacity will come in Lucknow, which is currently operating at about 500 beds, and that will scale up to about 1,000 beds, 950 to 1,000 beds. We expect over the course of this financial year to add in maybe another 100, 150 beds in Lucknow itself. Like I mentioned earlier, construction is already on in Lucknow. We already have operating rooms being built, wards being built, ICUs being built in Lucknow as we speak. Similarly, in Patna, we are currently at about 330 beds. That facility will scale up to about 650 beds. And the same story in Patna, we are currently building about 10 operating rooms there. We have beds getting added there. So all this activity is happening as we speak, and as and when these operating rooms, beds, ICUs come on board, we will start activating them. And we're also bringing in additional services like radiation oncology services being added in both these facilities. So that will be a large part of the addition in the assets that already are operational. In addition to this, our Noida facility, for which we have already started the construction, there's already cement going into the ground there. That hospital will be about 550 beds by the time it's completed, and we expect, like I said, that to come on board in financial year 25. So these are the new beds that are coming in, and of course, we also are adding in specialties. We're also adding in doctors into our mature facilities, especially in Gurgaon. We continue to look at the greatest talent across the country and bring that into the system as well.
That's good for us, Pankaj, but give us a couple of more details. You've been stressing on new as well as mature beds, right? What is the margin difference between the two, if you could put a number to it?
So actually, we've seen our mature hospitals do very well from a financial margin point of view. As you can see in our filing information, our EBITDA margins around 22, 23% at a consolidated level. Interestingly, our Lucknow facility, which is just about 2 years operational, that actually has been performing exceptionally well in a very, very short period of time. That has actually delivered in financial year 22 EBITDA margins of about 28%. And we see the growth in that actually very strong as well. And our Patna facility, Patna just started in its inpatient services in January of this year. That's already doing very well. We had a very minimal loss of just about 2 or 3 crores in the first quarter of financial year 23. So that continues to grow well, and we see that performing and heading towards growth and profitability in a very short period of time as well. So across our mature assets, across our new assets, we see very strong growth. We see very high RPOPs. We see strong EBITDA margins across the system. And we hope that these continue. We continue, as Dr. Trehan said, to focus on making sure that we deliver the highest quality, highest end of care. And because of the complexity of care and because of the super specialty care that we offer, we have been able to deliver this kind of performance, even though we try to make it as reasonable as possible for the public. So this has been a model that we have followed over the last 10, 11 years, and we believe that it has led to success, and we intend to continue to stay focused on always making sure we deliver the hihighest quality of care.
Take that point, and which is why we'll give the last word to Dr. Trehan himself. Dr. Trehan, you've been helping Indians with their medical issues. Just wanted to know how much more will you help international patients as well, because pre-COVID it was around 10 to 12%. Now it's clawed back to 6%. How long before it goes back to pre-COVID levels?
So it's improving month on month because of the fact that now that connectivity has been restored, and also the embassies are working like at more normal levels, so the visas are now being issued. So like even in Iraq, I mean, our own patients, about 140 of them, are waiting for their visa clearance, which is happening now. So we see an incremental, as we speak, we are seeing an incremental flow. And not only that, we expect it to go even higher than pre-COVID because of the fact that there is a big movement. Like you heard the Prime Minister launch the 2 schemes about Heal in India and Heal by India. So there is a lot of push, and all the facilities are being streamlined. Like medical visa issue is going to be in a very short time. Then there'll be a special channel at the airports when these patients arrive.
Right.
And we as providers are actually going to give them airport to airport service so that the quality of care that we can offer to internationally improves on a daily basis.
Right.
So I think that India has a huge potential, and a lot of people are seeking care in India. We just have to facilitate it properly.
Okay, all right, Doctor. Thanks so much for joining and wishing you, your team, Pankaj, all the very best for the time being. The health is good, and your shareholders as well will be very happy looking at the returns. Well, for the time being, slip in a short break. Come back. We'll continue our focus on the markets.